Now I'm going to bring in my colleagues, starting with Dean Russell.
Thank you, Chair. I've got several questions. I'll start with my first one, which builds upon the very powerful testimony earlier, in particular a comment by Jonathan, where he mentioned about the sheer amount of paperwork that's required when trying to get support. I was interested in all of your views on how do we cut through some of the red tape, and is there a role for technology there in terms of having a better way of tracking and monitoring how people are asking for help and making sure they get it quicker? If I could start with you, Fiona, please.
So Jonathan's testimony, I think, is what we hear day in, day out at Alzheimer's Society. It's just so hard to really navigate what is such a complex system to get any support, information or guidance. And I think the other bit to mention is that this goes across the NHS and social care, and there are gaps between that. So, you know, if you're worried about your memory, you'll go into your GP practice, as John described. It may take a long while to get your diagnosis, but you are referred from primary care, probably to a mental health trust, to see an old age psychiatrist to have your memory assessment clinic. And at that point, you may then be discharged without any post-diagnostic support, because it is incredibly patchy through the country. The other point is that the majority of care, as we've heard today, is coming through the social care system, because at the moment there are no treatments that will slow or stop the progression of the diseases that cause dementia. So again, you're then having to navigate through the social care system, many telling their stories, I mean, more than once, huge amounts of bureaucracy, and no clear guidance on where to go. So technology is important, but I think there is a role for dementia navigators, people who really understand your story and just understand the needs of the individual, you know, putting what matters to that person with dementia at the heart, and that person will help and enable the kind of navigation through this really complex system. And that's one of the things at Alzheimer's Society, through our Dementia Connect model, that was actually in the long-term plan as an example of, you know, navigating through this complexity, you know, telling your story once, technology enabling that to be then shared with multiple agencies. I think that is kind of a very simple step forward in the first instance.
To improved integration across the systems, and perhaps technology to support that and people. Thank you. If I may come to you, Caroline, as well. My question really is, would you agree, I suppose, with Fiona? I've got a few questions, so if you don't mind being brief, that would be really appreciated.
Yeah, I would, but thinking about the bureaucracy that Jonathan was talking about, a lot of that is defensive on the part of health and social care, that are trying to bat away demand, reduce the costs. It's not the case everywhere, but it's a very common experience. So actually, if people didn't feel the need to safeguard their resource in quite such a vigorous way because they're so broke, then I think we would find behaviour would change. But we would need to incentivise that as well. And part of that might be by giving people more rights than they have at the moment.
Thank you. And Sarah, if I may ask you the same question.
Yes, I agree. I mean, the system is set up to ration, isn't it? The social care system, first of all, you cross the care eligibility threshold, then you cross the means tested eligibility threshold, and then if your needs really rise, you end up in the continuing healthcare system. And we know that you know, areas set budget targets to reduce their spend on CHC when they've got tight budgets. If that's the case, it's not going to be easy to achieve it. There are criteria, but you know, all criteria are open to interpretation, and I think that there can be a real battle there. I think integrated care records, electronic care records could help with this, but I really think that the whole focus of, you know, we've been talking recently about the bill that's coming forth on integration and innovation around earlier intervention, you know, putting in the support before you cross that eligibility threshold, finding a way to fund the system adequately so that you can meet the people who have got really high needs, but you can also invest in preparing people, helping people, you know, set themselves up for the future. And it doesn't have to be bureaucratic. The bureaucracy is all about managing the system as it is established in law, actually.
Thank you. And